Dr. Moshfegh is board certified in vascular and interventional radiology with a subspecialty in venous diseases. Dr. Moshfegh will discuss injections and epidurals, what they are, how they're used. Dr. Moshfegh, welcome.
Thank you.
Can you explain what these procedures are?
So epidural steroid injections are basically an injection of a steroid into the space that's right outside the dural sac. It's a potential space where all the that surrounds the spinal cord and the nerve roots and the CSF. We inject, short-acting medications like lidocaine, intermediate-acting medications like Marcaine, and then long-term relief steroids that help with anti-inflammatory effects.
And the injections, are those in different areas, or are they kind of a separate thing from the epidurals?
Injections can be anywhere, really. They can be in joints, shoulders, hips, elbows. Epidural is specifically for the spine.
Okay, and what kind of conditions do these procedures treat?
So epidurals can be used for a variety of conditions like disc herniations, facet joint arthritis, sciatica when a patient has back pain and it radiates down their leg. There's sometimes cysts around the spine and little annular tears in the discs that are herniated that can be treated with the epidural.
And I assume you went through kind of some of the conditions that injections treat. Are they similar in sense, like arthritis and related things?
Correct, yeah. For joints, it could be used for arthritis, for labral tears. If you have something in the shoulder or something is torn, an injection can help with that.
And what are you actually injecting?
So it's a variety of medications. I like to use a cocktail of three, which is one of them is lidocaine, which acts really quickly, which is the one that gives you the immediate relief. Marcaine is kind of like lidocaine, it's anesthetic, but it acts a little bit longer, so it gives you the intermediate relief. And those two act in combination while the steroid takes effect. And the steroid's kind of like anti-inflammatory. So a lot of times the pain comes from the inflammation, and the steroid helps to cool the inflammation down.
And how long lasting is the relief from these type of procedures?
It depends. It depends really what the pain is coming from. If it's coming from a smaller disc bulge in the spine and you inject the epidural, it's possible that it can give you pain for up to a few weeks, and in that time the disc itself can resorb, and it's possible that you may not have the pain again. But a lot of times it takes a series of injections, maybe 3 or 4 during the course of a year. And throughout that year, the disc sometimes resorbs on its own, so you can get permanent relief.
And what are the types of patients that benefit most from these procedures?
So patients that have kind of persistent back and leg pain, they've tried, the medications and stuff like that, and it's just not helping. Like they still have the shooting pain down their leg, they still have that lower back pain. Nothing seems to be helping them. The epidural can really help with that, and the same thing goes for the joints.
And what are the risks of these procedures that patients should be aware of?
So there are some risks that, we are using needles, so there's a small risk of bleeding, small risk of infection. We are sterile throughout the procedure, and our needles are pretty tiny. There is a theoretical risk that a patient could have a pretty severe headache afterwards, although those risks are pretty low in the right hands. And we use imaging guidance to guide our needle into the correct space, make sure those type of things don't happen.
And what's the recovery time for these procedures?
Recovery is pretty quick. I mean, we watch you here for maybe 15, 20 minutes, make sure you're doing okay. You don't have a bad headache. We have you laying flat on your back. And then after that, we kind of get you up, and you can have somebody come with you, drive you home, and just rest for that 24 hours after the procedure.
And I would imagine that the recovery from the injections in other areas aside from the epidurals is similar.
Similar, even quicker. It's almost immediate recovery.
And how effective are these procedures?
Again, it depends. I mean, if you're having low back pain from just a disc, it can be as low as 50%, but sometimes up to 80%. If it's a sciatica type symptom and we inject the epidural, a lot of times the patients have immediate relief. It's almost 80% of them that they get like the immediate pain relief from the injection.
And what questions should a patient ask their doctor when they're considering having one of these procedures done?
They should ask, what are the possible side effects of this? Like what can happen? Sometimes you can get a localized pain right where the injection is. You can get some mild, dull headaches for the next 24 hours afterwards. They should also bring a list of their medications and ask if there's any, contraindication doing the procedure while they're on these different types of medications.
And are there some questions they should ask about their doctor's experience and kind of educational background qualifications?
Yeah, I mean, they should definitely be having it done under imaging guidance, which is either fluoroscopy, X ray, or CT, because you want to know you're in the correct space. Definitely. It's been shown that about 30 to 40% of the procedures, when they're done blind, actually miss the epidural space. So it's important to know that it doesn't have to be an interventional radiologist, it can be an interventional pain guy, it could be, something like that, but they should be using imaging to guide the injections.
Okay, well, that's great information. Dr. Moshfegh, thanks for taking the time to speak with us today about injections and epidurals.
Sure. Great talking to you.